Ladies and gentlemen, ministers of the Canton of Zurich, mayor of the city of Zurich, dear Lord, ladies and gentlemen, it's a great pleasure to welcome you here also for this first part of the Life Science Zurich Day. And the first part, a very brief introduction, is organized by Health Ties. Now, this is an acronym that probably doesn't tell very much to you. It is the acronym for Health, Technology, Innovation, and Economic Success. And since this is the House of Switzerland, and since we're going to talk about healthcare, we want to start with a poll. We're going to show you two questions, only two questions, very briefly, to get your temperature on what your feeling is about the status of the healthcare system. So, and this will be used in the panel discussion later on as the basis for the discussion. So, is the majority positive or negative? Okay, so we see that it is about 2/3 to 1/3 positive. So we have most of you, 2/3 of you feel that we're on the right track, but there is a considerable number who feels rather negative about it. So Greg Tutton, who will then guide through the panel, will actually take these results up and we'll base this. So I think we're all quite interested what comes out. Okay. I think both our next two speakers have their work cut out for them.
We are not only going to look at the Olympic motto, but also at the topic, the future of health. And in line with the Olympic motto, faster, higher, and stronger, I've chosen 3 adjectives for the future of health. It's efficient, it's interdisciplinary, and individual. Educational work. We, and this includes government, shape the development of healthcare. That also means making these developments available, raising the awareness of new chances, and take society with us on our way.
It is a very, very critical fact that decade by decade into this 21st century, populations will increase, life will become longer, health mechanisms will become more sophisticated, and everything will cost so much more. It's a fact of life.
So it shows the absolutely incredible decrease in the cost of sequencing the human genome. And now it really is the cost of a medical test. I don't know the exact up-to-date statistics, but I would say everyone in the United States spends between $5,000 and $10,000 a year on healthcare. So this is getting into the realm of 1 year's worth of healthcare. It's soon going to be about 1 month's worth of healthcare. So having said that, let's talk about 3rd generation DNA sequencing. This is going to be extremely fast, very cheap, $100 maybe, £100, and basically push button. So someone could buy a device, take some DNA that someone put on a glass or a Coke can by drinking something and sequence it.
So where do we go from here? Well, the idea is to put real-time outcome benchmarking for any surgical procedure into the hands of any surgeon anywhere in the world. No longer big databases sitting in hospitals. You can now do it on an app. And so we're working with the Royal College of Surgeons on a global export idea, which will enable a surgeon anywhere in the world for any procedure to know how good they are.
fast-track personal medicine. And it's a model that is focused on embedding a biobank within the healthcare structure that can be used for both research purposes as well as clinical purposes. And we're using a dynamic consent model. And it's very much about aligning existing systems and using those who come into the hospital, seeing them as a cohort that we can track over time. And there will be benefits for them as well as for research. But the important thing about personalised medicine is that it's actually putting people at the centre and very much aiming at tailored care. And so when we were developing our dynamic consent model, we very much focused on the ways that we could develop an IT mechanism that would put individuals at the centre and think about their needs.
The more concrete goals of the center is to become a regional leader in personalized medicine, provide state-of-the-art genomic technologies for research groups of the medical center and in Hungary, and use genome technologies for the benefit of patients of this region, which is interpreted broader than just the eastern part of Hungary. It includes part of Romania, Ukraine, Slovakia. These are the areas where patients actually come and visit the hospital. Just to show you what we have done, we took three diseases: psoriasis, inflammatory bowel disease, and rheumatoid arthritis. These are all somewhat related diseases. Took large number of patient samples and then identified genes which are either selectively representing one patient or the other, or we were able to identify those which are characteristic of chronic inflammatory diseases.
And I put up here various terms of how we know such initiatives, because there are so many, and I put them on that tree of research. So they're interesting leaves, and they're called democratic science because we've got all these people contributing, patient-driven research, specifically for patients being involved, participatory research, crowdsourcing, or the bottom-up research approach, which is maybe a much more encompassing term. Now, no matter what you call these kind of initiatives, they have one distinctive feature in common, and that is that ordinary citizens are involved in the initiation, in the control and ownership of the research process and the research outcome. That fits actually quite well with our vision about medicine, a medicine which will not any longer be more reactive to symptoms and diseases, but proactive to perhaps allowing us to avoid this altogether. And as you see in the P4 medicine, participation is critically important. It's one of the important aspects. A wide participation of people who will become part of the research enterprise, who will contribute data, share, and therefore will allow us to derive knowledge that allows medicine to become predictive, preventive, and personalized.
Well, I guess there's just a couple of points I would make. I think some technologies are so powerful that they're pretty well unstoppable. I don't think there's any chance of just simply stopping progress.
And there's another device that tells you what your blood pressure is. This is where I see the capability to have that trust and that transparency do a fantastic amount of good.
And but while the data is in the bank, it is invested and has an economic value. And so if you take this analogy and create something similar for health data, a health data bank where you have the control over it and not the NHS or any other insurance company, if we can build something like that, I think that would be very, very powerful.
I think privacy is the key concern, and databases are the issue.
So I think it's a case of sorting out joined up thinking in terms of health prevention. It's not just the health service, it's about things like Boris Johnson getting people on bikes in London, which is great. It's about sorting out the food chain, which is one of the most difficult things to fix. And obesity is the biggest, well, obviously the biggest problem. It's an incredible problem globally that is not being resolved properly. At the moment, the only way you can fix diabetes and obesity, gross obesity, is through surgery, and that scratches the surface of the problem.
And it's one reason why, in some sense, we've reached the state that we've reached, where everyone can see clearly in their household bills, clearly in their monthly premiums, not in the UK, where you have a national healthcare service payer system, but in places like Switzerland or the US, where our insurance premiums are increasing and increasing. Everyone can see that the model's not working. Everyone can feel that the model isn't working. And yet, how do we find that big idea? How do we start collecting the data? How do we build trust? This is partly what we're trying to establish in Health Ties, which are how do we collaborate to ask these questions in more of an open forum, and how do we engage each other to invest in things that might fail, but in things that also might unlock new ways of working together in healthcare and new ways of engaging the public to contribute more so that we can all have a better outcome.